Does chlamydia lead to infertility for women? Imagine discovering that a common infection could quietly threaten your future ability to have children. That's what happens with chlamydia, a bacterial sexually transmitted infection that often shows no symptoms. If left untreated, chlamydia can cause serious damage to a woman's reproductive system. The bacteria can spread from the cervix into the uterus and fallopian tubes, leading to a condition called pelvic inflammatory disease. This inflammation can cause scarring and blockages in the tubes, which are essential for conception. When the tubes are damaged, it can lead to tubal factor infertility, a major cause of difficulty in getting pregnant. Research shows a strong link between chlamydia infections and infertility in women. For example, studies have found that women who test positive for chlamydia are significantly more likely to experience infertility compared to those who do not have the infection. In fact, about 3 out of 4 studies reviewed reported a positive connection between chlamydia and reproductive problems. The risk increases with repeated infections, which can cause more extensive damage. Recurrent chlamydia infections also raise the chances of ectopic pregnancies, where a fertilized egg implants outside the uterus, which can be life-threatening. Since chlamydia often causes no symptoms, many women may not realize they are infected. This makes regular screening especially important for sexually active women, particularly those under age 25 or with new or multiple partners. Early detection and treatment with antibiotics can prevent the bacteria from causing long-term damage. If the infection is caught early, the risk of infertility drops significantly. But if the infection remains untreated, the damage can become permanent, making conception more difficult or impossible. In summary, chlamydia can indeed lead to infertility if it causes pelvic inflammatory disease and damages the fallopian tubes. Repeated infections increase this risk, and untreated infections can result in serious reproductive health issues. The best way to protect fertility is through routine screening, prompt treatment, and safe sexual practices. If you're experiencing fertility issues or are concerned about STDs, it's important to see a healthcare provider for testing and personalized advice. Protecting your reproductive health starts with awareness and action.